My name is Abby. I will be your nurse today. I will be doing a full head-to-toe assessment today. Can you verify your name and birthday, please?
Albert Einstein, January 2nd, 1968.
Thank you. You'll notice I washed my hands and pulled the privacy curtain. Can you tell me what day it is?
Saturday.
And the time?
It is 7:20.
This notes that my patient is alert and oriented, ×2. My patient appears to be clean and dressed appropriately for the weather. His skin is dry, cool, and intact and appropriate for his ethnic background. Vital signs were taken prior to this and were all normal, including blood pressure, pulse, respirations, and temperature. Can I test your capillary refill? And all of these were noticed to be less than 1 second. Now I'm going to test your skin trigger for dehydration, which is normal. And the patient is able to speak and hear appropriately for the exam today. My patient's head appears to be a normal shape and symmetric. Hair is evenly distributed. I'm going to start by palpating your scalp. Please tell me if you feel any tenderness. I do not note any lesions or abnormalities. I am now going to palpate your sinuses, so please tell me if you feel any pain. You should feel tenderness, or you should feel pressure, but not tenderness. Okay? I'm going to start with the frontal and the maxillary. I'm now going to palpate for the temporal artery. And I am going to now test for TMJ. So please open your mouth, put your jaw forward, and move it back left and right. Do you feel pain or popping? Good. I felt no crepitus or clicking. I'm now going to test cranial nerve 5. So please tell me if you feel this. Do you feel this?
Mm-hmm.
Thank you. And now I'm going to test cranial nerve 7. So please smile. Frown. Puff your cheeks out. Thank you. This indicates that cranial nerves 5 and 7 are normal. So now we're going to move on to the assessment of the eyes. When I look at your face, I see eyes that are symmetric. I do not note any abnormalities or lesions. Your eyelids and eyelashes appear to be normal. The pupils are equal and round. First, I'm going to look at your conjunctiva, so could you please look up for me? Conjunctiva appears to be clear, and I do not note any abnormalities. I'm now going to look at your sclera, which is white and which is also normal. First, I'm going to shine a light into your eye to test for your red reflex. So if you could please stare forward. Good. And again. And that was normal. So now I'm going to do a vision exam. So this is the Snellen chart, and I'm holding it 20 feet away. Could you please read the bottom line?
EDF, CZP.
Thank you. So this indicates you have 20/30 vision, testing cranial nerve 2, meaning that you can read at 30 feet what someone with 20/20 vision could read at 20 feet. Now we're going to do the confrontation test. So this is testing cranial nerve 2 and your visual acuity. So if you could place it over one of your eyes, please. I'm going to shine a light from the back of your head, and please tell me when you see it.
No.
Thank you. And the other one?
No.
Thank you. So that is normal. And now I am going to do the corneal light reflex test. So if you could stare straight at me, I'm going to test your corneal or your pupil reaction. So, and that is normal. That tests cranial nerves 2, 3, 4, and 6, and you have good accommodation. Now if you could follow the light, I'm going to test your extraocular muscle. Now when I'm doing this, I do not see any eyelid lag or nystagmus, and your eyes have parallel movements. So now I'm going to move on and inspect the nose. It appears to be midline. I do not note any lesions or abnormalities. Your Your nostrils appear to be patent, and I do not see any obstructions. I'm now going to look inside your nose. Mucosa is pink and white. I do not note any bleeding or discharge. The turbinates are consistent with the mucosa. The septum is midline, and I do not note any perforations. I'm now going to test cranial nerve 1. So if you could please shut your eyes, close one of your nostrils, and tell me when you can smell. And the other side.
Good.
Thank you. So this indicates a normal response. So now I'm going to move on and inspect your mouth. Please stick out your tongue for me. The mucosa appears moist and pink. And now, can you please say light, tight, dynamite?
Light, tight, dynamite.
This indicates that cranial nerve 12 is intact. So now could you stick out your tongue again for me, please? I'm going to look inside your mouth with the pen light and the tongue blade. So I see your tonsils are +2. The uvula is midline. And can you please stick out your tongue and say, ah? So this all is testing cranial nerves 9 and 10 and is normal. So now I'm going to move on to assessment of your ears. I see that they appear to be symmetrical. I do not see any redness, abnormalities, or swelling. I'm now going to palpate your ears, so please tell me if you feel any tenderness. Good. I'm now going to look inside of your ear. I do not see any redness, drainage, swelling, or any abnormalities. So I'm now going to test your hearing. So first I'm going to start with the Weber test. So I'm going to place the tuning fork on top of your head, and please tell me if you can hear it equally in both ears. Okay? Okay, good, that's normal. Now we're going to do the Rhine test. So I'm going to place the tuning fork on the back of your ear, and when you stop hearing it, please tell me, and I'll move it to the front of your ear. And when you stop hearing it, let me know. Okay?
Okay. Okay.
Okay, good. That indicates a normal response, and it means that air conduction is longer than bone conduction. So now I'm going to palpate your lymph nodes. Please let me know if you feel any tenderness. The pre-auricular, post-auricular, occipital, submandibular, and the submental. Do not note any swelling or tenderness. And I'm also going to do the whisper test. So if you could cover your ear, I'll come behind you and whisper, and if you could repeat it for me, that'd be great. 1, 2, 3.
1, 2, 3.
And the other one, ABC.
ABC.
So now I'm going to examine your upper extremities. So we're going to start by testing your gravesthesia. So please close your eyes, and I'm going to write a number in the palm of your hand. Please tell me what it is.
3.
Good. And now I'm going to test for strychnosis. So I'm going to place an object in your hand. Please tell me what it is.
Coin.
Good. So now you can open your eyes. I'm going to palpate the muscles in your arms, which appear to be normal. Now I'm going to feel for your radial pulses, or your brachial pulses, and your radial pulses. Good. So now we're going to do some muscle strength testing. So if I could have you extend your arms like this, pull towards you, resist me, good. Push away, good. The same thing with your wrists, push against, pull, good. And now do the same thing with your arms extended, push up, good, and down, good. Your strength appears to be fully intact. Now we're going to test your range of motion of your arms, elbows, wrists, and hands, fingers. Why don't you start by raising your arms above your head, like this, and down, good, and out, good, and down. Now put your arms behind your back, behind your head, behind the small of your back, good. extend your arms out. So this is testing for pronation and flip them over, or supination. Now I'm going to have you flex your arms, good, and back. And now we're going to do the same thing with your wrists, so towards you and back, clench a fist, good. So range of motion is fully intact. So now we're going to test your reflexes, starting with the brachial. Good. Now we're going to turn your arm this way, test the brachioradialis. Good. Now the triceps. Good. And now we are going to do the light touch test. So if I could have you, thank you. Do you feel sharp or pain when I do this? Good. And do you feel this light touch?
Mm-hmm.
Yes. And now I'm going to put the tuning fork on the top of your hand. Please tell me if you feel the vibration.
Mm-hmm.
Good. Lastly, I'm going to have you touch your thumbs to each of your fingers like this. Any pain, numbness, or tingling with this?
Mm-hmm.
Good, and that is normal. I'm going to palpate the lymph nodes on your neck, so please tell me if you feel any tenderness. Do not feel any swelling. Do not note any redness. So that is all normal. I do not visualize any jugular vein distension. I'm now going to feel for the carotid artery, which feels strong and the rhythm feels regular. I'm now going to listen for it. And I did not note any bruits. I'm now going to stand behind you, ask you to tilt your chin down and towards the right. Put my hands on your neck and ask you to swallow. Good. And I did not feel the thyroid, which is normal. Now please tilt your chin up. I'm going to palpate the sternotrapezius muscle, which feels normal. I'm going to ask you to tilt your chin down. And I'm going, and could you lift your shoulders up as I resist you? Good. And this is, good stuff, good. This is testing for cranial nerve 11, and this is showing that it is intact. So now we're going to do some range of motion on the neck. So I'm going to place my hand on the back of your neck, have you tilt your head forward and back, showing flexion and extension. Have you look to the left and to the right, showing rotation and putting your left ear down to your left shoulder, and same with the right side. Showing lateral bend. Did you feel any discomfort during this? I did not feel any crepitus or popping. So now finishing up my neck assessment, I will palpate the trachea, which appears to be in midline, which is normal. Good. So now moving on to the chest. Please take a deep breath in and out. I'm noting symmetrical inspiration and retraction. I'm going to start by palpating the maximal impulse, which is in the 5th intercostal space on the left mid-clavicular line, noting its size and locations, normal size being 2 to 3 centimeters in diameter. Now I'm going to auscultate the apical pulse for 30 seconds. I did not note any murmurs. The rate was normal and rhythm was normal. Now I'm going to check your thoracic expansion, so if you could take a deep breath in and out. Good. And that is normal. I am now going to test your tactile phragmitus, so please state 99 as I move down your chest.
99, 99, 99, 99, 99, 99, 99.
Good. So now I'm going going to listen to some lung sounds. First, I'm going to start with the bell, which I will be able to hear low-pitched sounds with. Deep breaths. One more. Good. Now I'm going to switch to using the diaphragm, which is best for high-pitched sounds. Deep breaths. Good. So now I'm going to have you turn around and I'm going to do your posterior chest. Well, actually first I need to percuss your chest. Any pain? Tenderness? Good. Okay. So now posterior appears symmetrical. I do not note any curvature of the spine. I'm going to feel or palpate your back. Please let me know if you feel any tenderness. Any tenderness?
No.
Good. I'm going to move my hands down your spine. Let me know if you feel any tenderness. Anything? This is testing for CVA tenderness. And now I'm going to do the tactile fremitus. So please state 99 as I move my hands down your back.
99, 99, 99, 99, 99, 99, 99.
Thank you. And now take a deep breath in. Good. Thoracic expansion is normal. Now I am going to listen to your lungs. So deep breaths. In and out. I did not note any crackles or wheezes on the posterior chest, and I did not note any on the anterior chest either. Now I'm going to finish up by percussing. So let me know if you feel any pain or tenderness, okay? Continuing on, I'm now going to assess the abdomen. It appears to be symmetrical and smooth. I do not note any pulsations, bulges, or obvious abnormalities. The umbilicus is midline. Skin appears to be cool, dry, and intact. I'm going to start by listening to your bowel sounds. I will be listening in all four quadrants and listening for high-pitched gurgling sounds, which will note active bowel. I heard high-pitched gurgling, which is good, normal. I'm now going to start by percussing your abdomen. I should feel tympany over the stomach and dullness over the liver. Good. I'm now going to do a light palpation, so please tell me if you feel any tenderness, okay? Any pain here? Good. Now I'm going to do a deeper palpation. I should not be able to feel the kidneys, spleen, or liver, which I do not feel. Lastly, I'm going to listen to the carotid arteries, or the aortic arteries, I mean. Which appear to be strong and regular. I do not note any bruits. Now I'm going to palpate for the femoral pulse, which appears to be normal with a regular rate and rhythm. And I'm going to palpate the horizontal and vertical sublingual lymph nodes. Do you feel any pain or tenderness in here? I do not note any swelling or abnormalities. So now moving on to assessing the lower extremities, I'm going to test the range of motion of the hip, knee, ankle, and leg. I'm going to start out by having you move your leg up and down. Let me know if you're feeling any pain with this. Out and in. And I'm going to have you extend your knee up. Good. And down. Any pain? Up again. And then move your hip out. I don't feel any crepitus. Go ahead and move this back down. Now I'm going to have you go up and get into the chair. Okay, now I'm going to start out by feeling for your muscle strength in your upper thighs, lower legs, and in your feet, which all appears to be normal. Can I have you go ahead and dorsiflex, which is up, plantar flex, down, invert, and expert. Good. All of showing good range of motion of the ankles as well. Now we're going to test for muscle strength. So push up on your left thigh. Resist me. Good. And the other one. Good. And now push against me. Good. And away. Good. Same thing with the feet. Push up. Good. And down. Good. This all indicates normal, good muscle strength. So now we are going to feel for the popliteal pulses, which feel normal, and the posterior tibialis, which feel normal, good rate and rhythm. Now I'm going to test the patellar reflex. Good. And the Achilles tendon. Good. Now I'm going to test your sensation. So I'm going to use a paper clip and let me know if you're feeling any pain. Can you feel my touch? Mm-hmm. Good. And lastly, feeling the vibrations of the tuning fork. Do you feel the vibration? Good. Which all indicates a normal response. So finishing up the testing for the lower extremities, I'm going to have you take the heel of your left foot and run it down the right front of your leg to test for coordination. Good. And now the opposite. Good. So that test is positive and you have good coordination. I'm going to have you stand up. We're going to finish the remainder of the neurological testing. So now we're going to have you lean forward and touch your toes. Good. Noting spine alignment, which is good. Any pain or crepitus with that? Good. So now we're going to do the Romberg test. I'm going to have you face me with your hands and feet at your sides. Go ahead. I'm going to look for any swaying, which I do not see, so that's normal. Go ahead and close your eyes. Still do not note any swaying, which is normal. Good. So now why don't you take a few steps forward so I can observe your gait. And now come back. Good. Your gait appears to be normal. And now for the last test, go ahead and face this way. Walk heel to toe. Just like this. Good. So this is testing for balance and coordination, and yours appears to be normal. So now I'm just going to go over how I would examine or do a female breast exam. First, I would look at the patient and observe for symmetry, skin changes that I would note would be moles, scars, nipple inversion, any other abnormalities that I could see. I would have the patient raise her hand above her head and bring her hands behind her back and lean forward and observe for nipple retraction. I would note the axilla lymph nodes to check for any swelling. Then I would have my patient lie down and put her hand behind her head, and in a circular motion using both of my hands, I would assess and palpate the axilla and all of the breast tissue, noting any lumps, abnormalities, nodules, applying small, firm amounts of pressure on the nipple to make sure there's no discharge. Moving on to the testicular self-exam, I would teach my patient to look in the mirror, observe for any signs of redness or swelling. I would have him take his middle finger and index finger and then his thumb and put his testicles in between them and feel for any nodules, any skin changes, pain, or any kind of abnormalities.